I'm a physician. I'm a cancer specialist doing radiation oncology, working full-time. I'm a person who really likes to exercise and take care of myself. Health is very, very important to me.
Stephanie's active lifestyle was threatened after an injury to her lower back.
I lifted something very heavy and I herniated a lumbar disc. And I went for 6 years getting various treatments. Finally, I went to Johns Hopkins and I had a laminectomy and a spinal fusion. And I did physical therapy. I got a lot better. And then I exercised. I did everything I wanted. I had pain a little bit above the area where I'd had the spinal fusion. And over several months, I developed some numbness and tingling in my legs, feeling that my legs were actually weak. I felt like I was walking through molasses and I had numbness and tingling. I'm telling you, I couldn't do very much. I was extremely disabled. I was very, very worried. My husband tells me he was worried I was going to end up in a wheelchair. So I had MRIs. And they told me that I had some spinal stenosis at lumbar 3, which is above the area of the fusion.
Desperate to avoid another spinal fusion, Stephanie tried a number of conservative treatments to relieve her pain.
I had the epidural injections, which only worked for a short period of time. I went for physical therapy, which did nothing. Actually, it made me worse. I went to chiropractors, which didn't work. I had acupuncture, which didn't work. I had radiofrequency ablation, which didn't work. I took pain medicine, which was really only a Band-Aid, and it was really not a good answer because it wasn't solving the problem. So my husband brought me a newspaper article talking about minimally invasive spine surgery at the Bonati Institute.
After learning about the Bonati Spine Institute, Stephanie scheduled an in-person evaluation.
So I went there. Everyone was very nice to me. They took a lot of time reviewing it. And they said, yes, at the lumbar 3 level, they thought that they could help me and that it wouldn't be a long recovery time. I might only have a day or two off work. And the postoperative recovery time would be very minimal. So I decided that I was going to do it because I really didn't have many other options. And I thought, gee, the other procedure, it took me 7 weeks to recover from, and I had metal plates and screws, which I absolutely did not want to go through. So this sounded like a really, really good option.
The exclusive Bonati Spine Procedures utilize conscious IV sedation. This keeps the patient comfortable while awake during the procedure in order to communicate with their surgeon the instant the pain that brought them in is eliminated.
I remember actually getting on the operating room table, and then I remember the anesthesiologist being there and then giving me some light anesthesia. So I was sort of in a twilight, kind of asleep, but I could underhear what they were saying. And then I remember Dr. Bonati talking to me, specifically telling me what he was doing. Well, I am now here at the lumbar 3 area. This is what I'm seeing. This is what I'm doing right now. I'm removing the bone from this side of it. I'm going to this side. I'm removing some bone. I'm seeing some scar tissue. I remember him going through that. I felt complete trust. I mean, obviously he was an expert. He developed the procedure. I didn't have any anxiety or any problem with any of the procedure whatsoever.
Like many patients, Stephanie was surprised by how quickly she was able to be up and walking so soon after surgery.
I had the procedure, and then they wanted to get me up right away. And I was thinking, getting me up right away? I mean, this is very quick. Putting my legs down and starting to walk. I didn't have any of that feeling of the syrupy feeling that my legs were weak, that I couldn't lift them, no pain, actually no symptoms. It was like a miracle. I had no symptoms whatsoever. I could not believe it. I'd never expected to have a complete relief of all the problems that I've been going through for months, possibly up to 6 months. It was like, I actually called it a miracle, feeling that I had no pain whatsoever. And I just had so many things to look forward to, like a normal life. It was just like doors were opening up. It was a wonderful experience.
Now a decade has passed and Stephanie is still enjoying her active lifestyle, pain-free.
I'm someone who likes to be very, very active. I know from my experience, it gave me a new life. This is 10 years after my surgery. I still have no problem. I think that somebody should definitely consider this. It's not going to interfere with your life. The recovery time is extremely minimal. There was really no pain involved. And who wouldn't rather have something like that than a major operation? And I think it was 100% successful in me.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV.